Hi everyone, and welcome back to the Medical Minute. I'm your host, Chastity Darfus. May is Mental Health Awareness Month, and today we're talking about natural ways to support mental health. Things like diet, exercise, and daily habits. Joining me is Dr. Michael Ang to share some simple science-based tips for feeling your best naturally. So let's dive in. Hi, Dr. Ang. How are you today?
Good, Chastity. How are you?
I'm great. Thank you for being here with us.
Oh, my absolute pleasure.
So May is Mental Health Awareness Month. Why is it important to focus on mental wellness just as much as physical health?
Well, they're closely intertwined. I don't think you can separate one from the other. There's numerous studies that have indicated that mental health directly impacts physical health, and vice versa. So I think they're one and the same.
How do you define mental wellness?
So mental wellness, I would say, is somebody who is, well, why don't we say, let's define what mental illness is. So mental illness is more something that you are impaired. Your daily functioning is impaired. So an inability to take care of yourself, an inability to go to work, an inability to have meaningful relationships with other people, and to, just really live life to the fullest. And so once we, in the clinical setting, determine that somebody has some impairment, that's when we decide, okay, what kind of impairment is it? Then we can quantify and qualify it and decide what exactly is the diagnosis. So I would say mental wellness is an absence of those impairments, if that makes sense.
You talked about diet and exercise. So let's talk a little bit about diet and what role does it play in mental health?
Yeah, absolutely. So again, modern research and modern medicine has shown a direct correlate with physical health and diet and mental health. There's a lot of evidence-based studies that indicate your gut health can directly impact how well someone is in terms of their emotions. If they are emotionally stable, if there's depression, direct correlates with gut health, probiotics, prebiotics, eating well, and also correlations with blood sugar, diabetes, someone who's overweight. Those things can cause inflammation within the system, within your metabolic health and within your physical system. So inflammation in itself can affect your mental well-being. So it's absolutely imperative to eat correctly and eat healthy. And so when I say eat healthy, we're talking about eating a balanced diet, less processed foods that have a lot of antioxidants like fruits, foods that have a lot of prebiotics like vegetables, things that help you digest your food better. So if you think about it, the better you are able to digest things, the easier your body can convert that food into energy and can utilize that food in a more optimal way in all types of function regarding physical well-being and mental well-being. So that's why it's really vital to be eating healthy. And so again, I think it's a matter of a balanced diet, eating right proteins, eating good sources of vitamins and vegetables and fruits. And I think those are really key elements to health. Yeah.
Gut health is kind of a very popular trending topic right now, and it was actually on my list to ask a little bit later, so I'm glad that you did address it. Is there the same research that supports that an unhealthy, fast food diet triggers mental illness? Or
yeah, I think more so for fast food diets, those foods are highly processed, and they're highly processed, and they have a lot of trans fats and a lot of other added ingredients that probably the body can see those as toxins. And when the body recognizes things as toxins and not good for it, it causes inflammation. And so one of the direct correlates with inflammation is cortisol. So the higher your body's inflamed, the higher your cortisol levels. And cortisol is a natural immunosuppressant. Cortisol wants your body not to react to outside foreign invaders, if you will. So what's going to happen? It's going to suppress your system. It's going to suppress your responses, and that will naturally make someone feel lethargic, tired, low energy, and not optimally, process their food or their nutrition, and not really be able to actively live an engaging, active life because of high cortisol levels.
I've done a little bit of my own research on cortisol,
Yeah.
trying to manage my own stress levels, because I know that there's that direct relationship. Can you talk a little bit about how exercise helps, or other methods to reduce your cortisol level besides diet?
Absolutely. So besides diet, exercise is just a tried and true way of releasing endorphins, right? Those happy chemicals that will help you sort of feel more balanced and stabilized. And it's a great avenue. It's just another direction of therapy. It's a great avenue to just release all the excess tension and stress while strengthening your muscles, strengthening your tendons, increasing your ability for cardiovascular work and capacity, and ultimately all of those functional improvements lead to better mental well-being. Because then if you think that your body can handle a lot more physical stress, it's apt to take more oxygen to your organs, and you live healthier, you live longer, and you can make better decisions. And there's also a direct correlation with physical health and cognitive well-being and cognitive health. So a lot of people who suffer from multiple comorbidities like diabetes, obesity, high blood pressure, and all these other chronic conditions, potentially have the risk of leading to worsening cognitive function, memory, being able to calculate and think quickly and have versatile thinking. So those are all important. So I would absolutely stress that exercise is a fundamental piece of maintaining health. But again, this doesn't mean that you have to run a marathon. We're talking whatever the American Academy of Cardiology or whatever the American Association of Family Practitioners, whatever they're recommending in terms of daily activities. I think right now it's like at least 30 minutes 5 times a week for cardiovascular fitness, and at least 2 to 3 times of weight training. Right. So those are really definitely something that most people can fit into their schedules, and it doesn't have to be completely over the top or to the point of exhaustion. But these are just really fundamental exercises that you can do to improve your overall well-being. Walking, absolutely.
Walking is a great.
Absolutely.
I'm a huge. I walk a couple miles a day, so
I love it. Yeah. So walking is completely underrated. Before, older schools of thought were like, okay, when we look at cardiovascular fitness, you have to run, or you have to swim, or you have to bike. But even getting in, this is a very randomized number, but 10,000 to 12,000 steps a day on daily activity of walking in itself lends to better body composition, better, fat loss, and it helps actually you digest food better. So just this simple act of walking, and you don't have to necessarily designate 1 hour of walking. It's doing laundry, it's mowing the lawn, doing daily activities, going to the mall, walking around. Fitting those 10,000 steps in itself is you're doing yourself a huge favor. In addition, if you're adding weight training to that, those are all just really great modalities of getting fit.
How effective are practices such as meditation, yoga, journaling, things like that for stress reduction?
Sure. So for meditation and yoga, those practices have been going on for thousands and thousands of years, and I still think there's absolute true value and merit to those things because it helps with mindfulness and groundedness. A lot of things based in psychiatry and in mental health are based in Eastern religions like Taoism and Buddhism, and a lot of those things that they really want to emphasize is being present and being able to just sort of recognize the now, your own breath, taking in your own breath, just being able to just take it easy and not let life just fly by you, because those are those triggers that make us feel very anxious. Our heart starts racing, we start thinking, and our mind just goes out of control. So being mindful, being present, being able to just take it still and a slow and easy breath, that is something like meditation. And yoga would be a combination of meditation, stretching, and also, physical stimulation. So again, thousands and thousands of years have these things been practiced, and even now they're absolutely wonderful tools in getting in shape mentally and physically. Journaling is more of like an introspective exercise. For your daily activities, it's hard to sit down and process your day. So people who have what we call these anxiety disorders and issues with constant worry and also obsessions, journaling helps them almost meditate, stop, take it easy in the end of the day, decompress, relax, and write out their thoughts. What did they do today? What did they learn from the day? And what can they do tomorrow to make their life better? And so you keep this constant documentation of your life. You can then refer back and see, okay, that didn't really work for me. Right. So what I'll do tomorrow will be this. And then the more you learn, and now you have it all documented, right. And not only does that act as a guide for you in the future, but it is a therapeutic tool for you to decompress and process your day.
Right. Self-reflect.
Yeah. For self-reflect.
Yeah. Awesome. Let's talk a bit about social systems and support.
Okay.
How important is community and those social systems in your life for mental wellness?
It's non-negotiable. The amount of evidence to show that people who don't have social support are far more likely to have depression, compounded with medical comorbidities, the evidence is staggering. So even to have a friend, to have a community, to be a part of the church, or to have somebody who checks in on you, those are absolute keys to maintaining good health. Because the community or your friends or your family, those are the people who know you best. Mm-hmm. And so if someone has poor insight and doesn't know, if they're feeling sad, or it's hard for them to define their own emotions, certainly your significant other or your child or your mother will tell you, like, hey, you look sad, and give you some introspection and some reflection to understand, like, what is going on with me? So that support not only acts as a gauge and a monitor and a radar to how you are doing, but it's also actual medicine. Even if we can go back to the most primordial or fundamental things about human nature is, a newborn baby won't thrive and won't live if it's not held and touched and comforted and nurtured. Same goes for for a child, for an adolescent, and for an adult. Being held, being comforted, being nurtured, whether it's emotionally or physically, those things go a long way. They release oxytocin. They release all these different chemicals that help with lowering blood pressure, lowering cortisol, increasing endorphins. Again, all of these things that just compound and improve upon just one's own well-being. So I would say, from a community perspective, from a family perspective, and from any type of social support, it is absolutely key and essential to have that. Are there people who are alone and don't have those supports and still can function and are possibly happy? Absolutely. That in itself might be a diagnosis, right? But still, it is possible. But for the majority of people, having a social support is very rewarding, enriching, and important.
Thank you.
Yeah.
So let's talk a little bit about the harder piece, mm-hmm. and that is seeking help through your primary care, psychologists, psychiatrists. There's an access issue. People mm-hmm. struggle to get in. Talk a little bit about what we're doing here locally, some treatment options for somebody maybe who's dealing with depression that isn't responding to medication. So let's talk a little bit about the more medical side of mental health.
Sure. So back to the beginning part of your question, there are a lot of patients who still find that there's a big stigma to psychiatric illness, and so the easiest way to get help from that is really through your primary care physician. Most primary care physicians have the skill set and ability to treat relatively moderate mood disorders, including depression, anxiety disorders, and even bipolar disorder. And those medications are easily managed and can be managed by a primary care provider. Now, with more extensive illness, patients who have treatment-resistant depression, more significant bipolar disorder, and schizophrenia, or diseases associated with paranoia, delusions, then we're looking at more powerful medications, which is often utilized by a psychiatrist. Within our community, when I had started here in 2019, we were really limited in terms of scope of practice and scope of capabilities because we had 2 psychiatrists. But now we are about 5 psychiatrists within the practice, and we're going to get a 6th psychiatrist. We had no mid-levels, and now we have about 6 to 7 mid-levels, nurse practitioners. And we also have a number of psychologists along with a training psychology program. So in terms of resources, our resources are now expanding and are more available. And it's just a matter of seeking out the appropriate steps. And for people who are worried about it, again, I would recommend they go to their primary care provider for initial assessment. And if it needs to be taken a step further, it can go to a nurse practitioner who is specializing in mental health, or it can go to a psychiatrist. And what we're trying to do in our community is expand access within our own outpatient clinics, and hopefully, in the next few weeks to months, we'll have more accessibility with walk-in clinics.
That's amazing.
Yeah, and so we're going to try to provide more of an acute service to patients who need mental health evaluations rather than having to go to the emergency room. If it is a more manageable, acute to subacute disorder, can we manage that as an outpatient, and can we plug them with appropriate resources and follow up so that they continually get better?
Great. Dr. Ng, thank you so much for being here to address this super important topic.
Absolutely.
Not just in May, but every day.
Absolutely.
So,
thank you for having me, Chastity.
Thank you. Thank you for joining us, and we will see you next time.